The pharmacogenetics testing is one of the game-changing, groundbreaking developments we have noticed over the years. And I have been a big fan of the pharmacogenetics assessments of individual variations in response, especially with patients with ADHD. We have an established background of understanding and helping people with ADHD over the years. And one of the key differences in response rates and tolerability of medication has been put down to pharmacogenetic variations. In plain English, it actually means that each individual is a patient which has different genetic profiles, and each genetic profile is unique to an individual. So, what may work for one of our clients may not work for someone else. The unique difference is based on the individual DNA. Now, there are two ways how DNA impacts it. Obviously, it's a lot more complex than this, but I'm going to break it down and try to make it as simple as possible. There are two main ways how genetics impact response to treatment. The first aspect is the impact of the deficiencies in the neural circuits in the brain, which then allows different medications to create different effective responses. So, for example, if the brain deficits indicate that a dopamine enhancing medication can lead to further improvements or better improvements than a noradrenaline enhancing agent, then using a medication which is predominantly dopaminergic could help. However, conversely, if medication which increase noradrenaline is what the brain needs, then using a predominant noradrenergic reuptake inhibitor or noradrenergic stimulant could help people respond better to meds. However, if both dopamine and noradrenaline are in short supply in the brain, then either group of medications would be helpful. However, we need to keep in mind that in about 10 to 20% patients, both these neurochemicals are in abundance, and further increase in these levels are unlikely to demonstrate a response. Hence, we then are in a better place to say who is treatment resistant and who is not. And we know that medication is only a part of the armory in treating ADHD. And so we can focus our efforts on the non-medication approaches, which includes the psychological approaches and the strict social interventions, which we have already discussed in a variety of different videos. So that is the first aspect in terms of the neurochemical responsiveness to medication. The second aspect with regards to medication treatment, which is crucially important, is the tolerability aspect. Now, in a nutshell, tolerability of the meds depends on how the body handles the meds. So, in our livers, we have separate groups of enzymes which are responsible for metabolizing these groups of medicines. So, for example, if we consider lisdexamfetamine or Elvance, one of the mainstays of stimulant medications, we know that the enzyme in the liver called the CYP2D6, which is responsible for metabolism of the lisdexamfetamine or Elvance, that intrinsic activity levels could make a significant difference in terms of whether someone can tolerate this medicine. So, if the CYP2D6 levels in the liver are elevated or the enzyme is overactive, they're going to destroy whatever dose of medication the Elvance is prescribed at. Hence, there wouldn't be much of a response. Take, for example, the converse of that. If the levels of enzymes CYP2D6 is on the lower side, however, then even lower doses of Elvance could achieve very high blood levels, which could mean, obviously, it could be more effective. However, in practice, it actually leads to intolerable side effects. So the intrinsic activity of the enzyme, which is responsible for neutralizing the meds, are equally important. Hence, we do realize these individual differences in responses could be explained significantly with this. How far has this research been evolved? It's about effective in about 60 to 70% cases. And this is in part because we haven't identified all the different genes which code all the different enzymes. I know, hi-fi stuff, but in the future, I'm hoping that this technology will evolve and we get to 100% status. Now, in the US, there are a lot of insurance companies who actually like to use pharmacogenetic testing right at the start. Because if we get the right medicine right at the start, which actually means fewer appointments, fewer side effects, fewer attendances to other specialties, and hence can lead to significant improvements. So, pharmacogenetic testing is becoming cheaper and more widely available and readily available, but we haven't still seen it being used in the NHS because it's still not 100%. But at least in the private sector, it's extremely affordable now and it is readily available. And it is just a mouth swab, which we sent by the post to get it done. Now, as a clinician, with this additional information could be quite crucial for treating someone with ADHD.